Good evening. Welcome to a regularly scheduled meeting of the Waterville City Council. If anybody would like an agenda, I believe they're located right outside the glass doors. And before we get started, Tim Beals, would you stand and lead us in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we get going, we have the disclosure of conflict of interest. Is there any counselor that feels they'll have a conflict of interest with the votes they'll take tonight? Seeing as none, moving on to the approval of the consent agenda. Could I get a motion for the approval of the consent agenda?
So moved.
And second.
Any discussion? All in favor? And could we get another microphone up here? Is there anybody here that...
Mike and I can share if there's not...
We got one coming. Good. Thank you. Unfinished business, Resolution 197, 2019.
Move to read by title only.
And second.
All in favor?
A resolution providing for override of the mayor's veto.
Move to adopt.
Second.
And Mr. Beals, would you like to come up first?
Thank you, Mr. Mayor, members of the council.
Yep.
I just,
You can move that mic up just a little bit.
sure.
Thanks.
My name is Tim Beals. I represent Delta Ambulance, and we had submitted a proposal recently to address the chief's concerns with regards to his proposal from a couple weeks ago. We haven't heard any feedback. It is tied to this particular item, and I wondered if there were any questions the councilors had that we could answer, or
Sure, Tim. It's my understanding that, and I had the chance to actually yesterday really get into this, that is it correct that if we have your ambulance at our fire department and there's going to be a delay, so our guys take it to the scene and they're there and there's an emergency and they need to get somebody to the hospital, they have to wait for one of your guys to show up before they can actually transport to the hospital?
initially it would require a paramedic to respond. The chief and I talked about this the other day as well, and as we move forward with the plan, we would be able to develop what's under Maine EMS considered a response plan that would eliminate that requirement in many situations, yes.
Any other questions or comments from the council?
I think I'd like to hear from the chief, actually.
Sure. Is there any questions for Tim while he's up?
Thank you.
Thank you. Chief?
All right. I obviously put some information together for you. So over the last year, I've really given the council, the town manager, and the ambulance committee the exact same message. And that message has been that I feel we need a backup transporting service here in the city of Waterville to supplement the good service that Delta is providing. There is no question that we have seen significant delays here in the city, and that is what I would like to tackle. I have been working with Delta since November of 2018. That is 1 year from now, or better than a year. It was the fire department that created the first proposal and presented that to Mr. Beals in January of 2019. We received, that was 16-page cooperative agreement. I had been communicating through email and obviously by phone with Tim. The town manager and I worked on it throughout the entire spring. We sat down in the summer, and we didn't receive the first proposal from Delta until August 7th of 2019. So the point of what I'm trying to establish here is we've been working on this for a long time. It was actively discussed throughout that entire process of Waterville being a backup service the entire time. In September and later in November, Delta stood firm with no other proposals or suggestions. On November 19th, I met with their consultant. And a short time later, we received another proposal. Actually, you received it before I did. And really what the proposal confirmed to me, and I have to be straight up and honest, is that the problem is real and it warrants attention in the form of a backup service. It also confirmed that our revenue projections were spot on, if not conservative. The notion that Delta would add all of our staff to their roster immediately confirmed that in fact my staff meets or exceeds the Delta expectation. When I asked him why he would consider working with Waterville and not other communities, he provided me with 3 responses. Number 1, Waterville has the volume. Number 2, the progressive nature of the fire chief and the agency. And number 3, the quality of our staff. This is exactly what I've been communicating or attempted to communicate to the council. If you were a citizen and only read the newspaper, you would literally think that I was a fool, literally, for not recommending the council move forward with Delta's plan, if you only had the information in the newspaper. But I assure you that your fire department has done nothing but increase the efficiency, make hard decisions, and try to serve our community in the absolute best needs that we possibly can. When I was asked by the committee about this use of funds that our firefighters worked hard to save on our tower truck, I could think of no better project to allocate funds to move people to the hospital in their time of need. There is nothing more important than that other than providing the direct care itself. There's been some serious misinformation and perceived negativity, so I would like my opportunity to clarify why I do not think that entering into the plan with Delta is our best option. I certainly believe it's an option, and I certainly appreciate the proposal. I just wished I would have saw it last year, to be honest with you. We cannot compare both of our options equally. We're talking about 2 ambulances. Delta is proposing 1. This is half of the plan. As the fire chief, I wanted to address 3 points: emergency calls when Delta ambulance is not available, interfacility transfers when Delta is not available, mass gatherings or events when other additional ambulances may be needed. This plan does not address interfacility transports when Delta is not available. Number 3, as Mr. Beal stated, a paramedic would be required initially for the ambulance to transport to the hospital. So in the early stages of this, we may have an ambulance sitting in the driveway that can't bring somebody to definitive care, and that is concerning to me. Number 4, Delta can't guarantee us a paramedic can respond. There's no guarantee that they've provided in this plan that a paramedic will be available. Number 5, our employees would be required to be assigned to Delta's roster, essentially acting as subcontractors. An equivalent example would be that Gerald McKenzie is doing a paving contract here in town, and he doesn't have enough trucks to complete the paving job. So we take our public works employees, we send them the trucks and the people so that he can remain profitable. We would not do that. It's not in the nature of the city to do that. Number 6, this leaves question as to the insurance liability coverage. I still have not answered all the questions. Number 7, we would have an ambulance with no ability to help our neighbor. So in this particular plan, it would be under the control of Delta Ambulance, and they don't want the truck going out of town. And I'm not saying I want the truck going out of town all the time either. But when Winslow or Fairfield or any of our neighbors really need help, and I'm talking on the real serious stuff, school bus rolls over. Why would we not support our neighbors? I'm extremely
Chief,
go ahead.
and we do have mutual aid agreements with those towns
We
in
do.
place. Is that correct?
We do, yep, and I just wrote all new ones that are built for the future. Built for now, built for the future, and strengthen our relationship between the communities. This plan would eliminate our medical director, Dr. Tim Pay, who has essentially volunteered in assisting us build our program here in Waterville Fire. We would lose him. We would fall under the medical direction of Delta, which is a private company. And a medical director can withdraw support from a provider if they choose to. I see that it's extremely problematic that we have a paid medical director of a private company could withdraw support for one of our guys essentially losing their license. I see that being problematic, and I won't, unless you want me to further elaborate, I'm just telling you that it's problematic, okay? Number 10, this leaves too many questions in the very moment that the call comes in to decide if a paramedic is coming, if what we're doing is okay with Delta Ambulance, if have I violated any provisions of our agreement. And the only thing that I want my staff focused on is getting to the scene as fast as possible, providing the best care within their means, and getting them to definitive treatment. I don't want them to have to worry about whether we're violating an agreement or not. My job is to limit the liability in questions, not add to that. And number 11, this plan falls completely under the control of the private company. Completely. I am your fire chief, and in the back of the room, there are your firefighters. They want to work for you. They want to work for you. Many have already worked for Delta and left for various reasons. Nothing is stopping them from reapplying, but they don't want to. They want to do what's in the best interest of the community, and if the interest of the community here was on our residents, there would be zero opposition to this plan. None whatsoever. Our backup plan solves the ambulance delays and availability on the projected 50 calls a year. It increases the operational capability of the fire department, consistent with every other fire department in the state our size. It adds resources, not reallocates. We're not talking about taking a truck out of one garage and putting it into another. We're talking about adding 2 trucks to the area. The backup model has zero impact to outside communities such as Belgrade and Vassaboro. I was extremely concerned when I read the newspaper because this may actually free up a paramedic. It may actually decrease Delta's response time to them small communities, and it may increase Delta's availability to those small communities. So it baffles me that this would be detrimental to our other communities. And also it would add resources in the, heaven forbid, the event that they needed them. This would increase firefighter safety, increase morale and the overall health of the department, add transport resources during large gathering and MCI events. The initial investment doesn't raise taxes, and this may generate revenue to sustain operations. This provides the city with complete control of our employees and our EMS system. They're under your control. You tell me how to run my department. I run my department to your standards. This gives our hardworking employees a sense of pride and ownership. That's a bonus. And most importantly, takes care of our residents when they need us the most. And please note, in closing, that no matter how you vote tonight, your fire department is in good health. And we're going to continue to stand ready in our role serving our important mission. you can rest assured that I stand committed in working with Delta to ensure that this backup plan is successful. And our agencies can continue to serve alongside one another in a respectful, professional, and high-quality standard method. So thank you. I appreciate the opportunity to talk and bring my information in front of the council. And certainly, if you have any questions, I'd be happy to answer them. And we did print off copies of the analytics that we did on the plan as a committee, if you guys would like to have those.
First, Chief, I want to say thank you. I've gotten a great deal of knowledge over the past year being able to talk to you, your men and women that support us at the fire department. Tim, for being able to communicate in this hard time. So I really have one simple question. I heard everything you said. The way the plan is written today, would you accept it?
Delta's plan?
Yes.
The answer would have to be no. My recommendation is to go with the best option.
Thank you.
Counselor.
Mike, I'd like to hear what your opinion is on this whole thing.
Well, I've said from the very, very beginning, I think the most important thing that we should have done was to conduct an analysis of what the problem is and how best to address it. Instead, the chief, in meeting with certain counselors, just went ahead to develop a plan and didn't include me in any of that. Contrary to what the chief said, in meetings that we had last spring and into the summer, those meetings were about the contract with Delta, had nothing to do with developing a separate ambulance plan for the fire department. First I heard of that was back in September. I still think that some more of that investigative work should be done. I see the Delta plan as an opportunity to give us time to do that study. I don't question the need to get patients to the hospital as soon as possible. And I think the chief is right in that there have been delays over the past year that really have not been acceptable. I think Delta has tried to address that. So I think that is a need. There is a problem, I think, with the paramedic situation that was talked about earlier, with Mr. Beals saying that they're going to have to work on how to get a paramedic available, because if the Delta plan is put in play, that ambulance is at our station, but really needs a paramedic on board before it can move. So there probably are 4 options about how that happens. Either Delta has a person readily available at our fire station as soon as the call comes in, and off he goes, or she goes. 2, chief is a paramedic. He might be on the ambulance. The ambulance can move if he's there. 3, the on-call. We do have paramedics on the fire department. They're not full-time. They're on-call. I have a real question about how quickly those on-call people could come, get in the vehicle, and off it can go. And so the 4th option is, I think, for Delta to rework their license with the state so they could have one vehicle that operates without the paramedic requirement. But I don't know how long that takes. So the question before you, I think, is how serious is that emergency need for transport? I can't answer that for you. I don't know truly myself. Those are the people that respond. They know what waiting is like at the scene of an accident. I'm sure it's not a lot of fun. I'm sure it's a very difficult thing. So that need has to be addressed. How best to do it is something I wish we had spent more time on at the beginning. If there are any questions, I'd be glad to.
Do you have a comment?
I'm not sure what my question is.
Okay. I won't go.
While you formulate that, I see Nate Rudy is here, and And Nate, would you like to come up and have a chance at the podium? And I promise we'll get to everybody that wants to speak on this topic. And I appreciate everybody's patience and thoughtfulness in their comments.
Good evening, Council and Mayor Isgrove. My name's Nate Rudy. I own a house on Burley Street, and I'm also a member of the Delta Ambulance Board of Directors. I'm sorry that I missed Mr. Beal's comments, and I only caught part of Chief Essler's comments, but I'll just share with you that I feel that this is not and never has been a referendum on the Waterville Fire Department, their readiness or willingness to serve. This is also not a referendum on the quality of service that Delta Ambulance offers, for which I have never heard a single complaint. There are some questions about some outlying times for response that we've had, and we're addressing those presently, but those outliers are not indicative of the response times or the quality of service that we normally provide. I will just echo what comments I have heard. Chief Essler has made it clear that there are more questions than answers on this issue. He has 11 points of concern that I've only heard this evening, and I've been very involved in this conversation. I'm very concerned about this conversation, not just for the citizens of Waterville, but for the other 16 communities that are served by Delta Ambulance and have been since 1972. Our only interest as a board of directors for Delta is to provide that level of service to your community. There is no urgency that I understand from what I know. There is no rush for you all to go into a decision this evening when there are so many questions to be answered. And we have offered a proposal that we think meets your needs, gives you the time you need to have a thorough and thoughtful deliberation that includes members of the medical community, includes Inland Hospital and Northern Light, includes Maine General Hospital. Those folks, I'm sure, would be happy to talk with you about this and give you their perspectives if you asked them. But so far, it seems like you've had a lot of your meetings in private, in a public building, which is interesting. And it seems that you are willing to circumvent your own purchasing policy to rush for a decision that you do not have to make this evening. We implore you, take your time. We will be your partner as we always have been. We will continue to offer the quality of care that we always have offered. We will address the issues that have been brought up. We're already addressing them internally. And we do not mean to besmirch the reputation of any of the members of the fire department. We do not wish to engage in a conflict with the chief. We just want to have a considered and thorough discussion about this. From my perspective, there's a lot of room for improvement on that. From my perspective, we're offering an opportunity for you all to do that. And we are happy to work with you all on this. We're happy to work with the chief and help you if you will take the time to make a thorough and considered evaluation of this. Bring in your own outside people to evaluate the numbers. Decide for yourselves whether this is a money-making venture or another cost to the citizens of Waterville that you can avoid with the only functioning regional partnership in Central Maine. From my perspective, having worked here as a municipal employee, having worked here on boards for other regional ventures, I feel very strongly that Delta provides a very high quality of service. And I hope you will not forgo that in a way that affects the other communities around here where people live, who shop here and work here, and will be potentially adversely affected by your decision tonight. You don't have to choose tonight. Let us work with you, please. And thank you. I'm happy to answer any questions you have.
Counselor.
Nate, how many people are on the Delta board?
What are there, 8? Excuse me, 13. We have a couple of seats open, by the way, for community.
How is it determined? Is there any criteria because of the communities that are serviced by Delta? Is there anything that says there have to be at least a certain number of people from this community, a certain number of people from that community? Is there anything like that?
Not that I'm aware of.
And so it's just whoever.
Yeah, we'd be happy to have another volunteer from Waterville to join the board of directors.
Are you now? You're the city manager in Hollowell, correct?
Correct.
So were you invited to serve in that capacity, or were you invited as a citizen of Waterville.
You all may know from the news that there was a considerable discussion about our own fire department in Hallowell 3 years ago. I am a strong proponent of our fire department. You can speak with anyone who might call that into question is welcome to speak with the fire chief in Hallowell. We were just having a conversation about regional service delivery in the light of some discussions that we were having with the city of Augusta at that time, all of which have since been resolved. But I will say this, even though Hallowell does not use Delta ambulance service, and we're very, happy with the relationship we have with Augusta, I perceive that there will be a ripple effect to the decision that you all are being asked to make this evening. And it may affect us as far south as Gardner and Hallowell and who knows where else.
This isn't so much a question as an observation, is that I think the conversation has kind of gotten ahead of itself a little bit, because, and when I met with the chief, this is what I told him, because we were talking about the short-term need, the long-term need. Honestly, I have concerns about the state of emergency services in general across the state of Maine, not only fire departments, ambulance service, but also police departments. I mean, anyone who reads the paper knows that communities are having a hard time hiring people into all of these positions. And, there's a little bit of me that's cautious about leaving the future of this to an organization that the city doesn't necessarily have control over. But at the same time, I think that this conversation has gotten a little more adversarial than I would like it to have been. And I'm not sure you can put the genie back in the bottle as far as that goes at this point. I think what we're trying to do is the best thing for the city of Waterville. And that doesn't necessarily, yes, we have to consider Delta and a long relationship that we've had with them, but we also have to look out for the long-term health of the city of Waterville and the health of emergency services in Waterville. I don't see, what we're talking about is 2 ambulances basically used for backup of Delta at this point. I'm a new member of the fire committee, although I haven't attended any of those meetings yet, because we still have 3 current counselors on the committee. And I think the conversation, there's 2 conversations. There's the conversation, the short-term need for another ambulance that the fire department could use when there's in times of need, and then there's a long-term conversation about whether we would want to expand that if we decide to get into this business. And I can absolutely guarantee you there's going to be a lot more conversation, and we're going to be very sure about the numbers before we commit ourselves to anything like that. But just to be upfront at this point, I think I'm a vote in favor of purchasing these ambulances. Because we need to enhance the service that we're providing here in the city and not necessarily just leave it up to what in the end is a private organization. And we need to take some level of control. And it is a little interesting that it's taken us doing this to sort of push this conversation forward to this point. And I don't pretend to know the history of what the conversation has been over the years and why it took so long, why we had to push so hard to get to this point. But those are just my thoughts right now.
Yeah, of course.
Thank you. So I, speaking from my perspective as a member of the board, we would have been happy to have this conversation earlier. I share your concern about the state of emergency services in Maine. I think that this goes completely in the opposite direction, this proposal, from solidifying those services. It goes in the opposite direction of what other communities are doing. I'm concerned that this really isn't a conversation about a backup service, but is a foothold for a full service. And once you all make this financial commitment, you own those ambulances. And once you start ramping up for doing this, that process will have a life of its own. You don't need to rush into this. I just don't understand why you would forego robust public conversations with experts who would be happy to talk with you. I don't understand why you would forego public meetings in lieu of private meetings in public buildings, I don't understand why you would forego your purchasing policy. I think there's just a lot of questions that I hope you all would ask before you make a commitment.
I wanted to spell this. We constantly had private meetings in a public building. Most committee meetings are, A, held in a public building, but they're not always open to the public. They're open to committee members. And what you say, an average committee meeting lasts about an hour, whereas our meetings lasted 3 to 4 hours at a time. We went into it looking for what was going on with the fire department, what their needs were, what they were thinking about for the future. And we stopped on ambulance service. It is something that we looked at. It was something that we saw where the chief may want to go in the future, but that today we had an immediate need, as he has spelled out. Now, I was concerned that I heard from other towns, Vassalboro, their EMS system, the town manager from Belgrade. It's odd that these people are involved in what we're trying to do for our citizens. What we're trying to do to make sure that our fire department, the men and women that work for us, have all the resources that they need to complete their job, in an efficient manner. We don't want somebody waiting 15 or 20 minutes when they're a cardiac patient to be transported to a hospital when we could readily do that ourselves. We're there currently. We're treating those people with our fire department's resources, and then you take them to the hospital. That's the way it's been right now. That's the way I think it's going to continue for a while. But my immediate concern is that 15 to 20 minute period where we could already be on our way. I know that you'll admit that in a cardiac situation, every moment is precious. Why wait? Why not have the ability to back you up, take our residents to a hospital, and then if they need to be transported from there, that falls on Delta. Let us get them to the hospital. I don't see a harm in getting our residents to a hospital by our own fire department.
Sir, I understand and appreciate your concern and your enthusiasm for wanting to make sure that the citizens of Waterville are receiving the highest level of care. There's no question about that whatsoever. I do believe that the 15 to 20 minute time frame that you're talking about is an outlier for our response time. And I think pointing to that repeatedly in this conversation is maybe creating a, it's not really accurate to what we normally deliver. There have been some outliers. We're going to address that. I think there are many communities that are served by EMS service where first responders provide first aid to victims of an injury. It happens everywhere all the time. It will continue to happen because that's the nature of the way we deliver those services. I just want to reiterate, we don't come here as adversaries to the city of Waterville or its citizens. We simply come here to try to give you all the best information that we can as your partners. And we're members of this community too. Delta Ambulance employees live in Waterville also. Members of the board own property in Waterville. I'm as concerned about this as you are. Since 1972, we have provided the best quality of care that we can provide to Waterville residents and these other residents. And frankly, it is the decision that you all are talking about this evening and the decisions you will make moving forward do have consequences for Vassalboro, China, South China, Oakland, Belgrade, every other community that's served. And for those folks, and also the CEO of the Area Agency on Aging, which addresses the needs of older people, for those folks to reach out to you, it's not adversarial. It's to try to give you all a broader perspective of what the rest of the communities in the region stand to lose so that you all can explore what you believe to be a revenue-generating opportunity and an increase in quality of service for Waterville residents, and it may not be those things. We're just simply asking you to take your time. You don't need to rush. and we will work with you. And if you have concerns, there's no reason why there can't be more representatives from the city of Waterville on the board of directors for Delta. We're not trying to circumvent your authority as a group of elected officials. We do want to work with you, and we feel like we can. And I feel like the proposal that Tim has made is a reasonable step forward that gives you more time to consider your options and to get some outside review of the numbers that you've been presented.
Does anybody else have any direct questions for Mr. Rudy?
Thank you for the opportunity.
Yeah, and you may be back up here. I've got a few questions. They may be for different folks. I want to ask some questions of the folks who had already spoken first. I promise I will get to every single person that wants to speak. I agree that this process was not done well, and it has set up an adversarial conversation. I think that all of us, however, have learned from this process, and I think going forward we understand how essentially the presentation that the chief made several weeks ago will be a kickoff to these kinds of conversations, a presentation like that. However, what I had asked for when I vetoed this was that we have more time to deliberate, that we have information presented, that we have public commentary period. And I feel like we've had a lot of that. So to get to the questions, a couple of weeks ago, the chief did a pretty in-depth presentation on the need for a backup service and presented essentially the financial information to show that that would not have an impact on Waterville residents. But I want to be clear that that presentation was strictly for a backup service, and I have a commitment from the chief that any further discussion of expanding the transportation service would not only expand the committee that exists today to include more members, to include any members of the public, and to be held in a manner that would be advantageous for public information and dissemination. The chief has stated that he tried to start the conversation a year ago, but that there was no response from Delta at that time. Is that Delta's position? Would Delta affirm that position or take a different position? And I'm not asking these in a belligerent manner. I want to be clear. I'm really asking because I'm trying to get both sides of the information here.
Right. No, the chief and I had conversations. We made internal changes to what we did, to our operations. We moved, we have the flexibility of moving vehicles around within our operation, and we did that. We added a truck to Waterville. As Mr. Rudy has pointed out, I mean, there are times that we are delayed. There's no question. They're outliers. It's not the routine service that we offer. But we have made changes. The chief and I have had conversations off and on over the past year, yes.
Okay. And Chief, would you say that's inaccurate? Okay. Given, and this might be for Nate, for you, or for Mike, given that the information that the chief has presented concerning strictly the backup service, what are the concerns of how that would negatively impact Delta if limited to strictly the backup service? And I'll start with Mike.
It's the paramedic piece. And there may not be any way to know how well that works or how well it doesn't work until it's tried. But I do have very serious worries about how quickly that vehicle can be put in play, seeing as though a paramedic has to be on board. Where is that person going to come from?
Okay, so you're not talking about the chief's plan, you're talking about the Delta plan.
Can I?
I'm sorry. Did I misunderstand your question? I'm sorry.
Yeah. Tim.
I was just going to clarify Mike's comment. The paramedic doesn't need to be on board for that ambulance to respond. The paramedic has to be responding, so it could be our supervisor, and it would likely be our supervisor that would be responding in his own vehicle. The ambulance certainly could leave the station, the fire station, and respond to the scene. It would not need to wait for a paramedic to arrive at the station, get on the ambulance, and physically go with the ambulance. So it could be a...
Oh, I wasn't aware. So the paramedic can get to the scene
Correct.
when the ambulance does?
Correct.
Okay, I didn't know
I
that.
see. Chief.
The only question I have is that new information?
No, you and I talked about that the other day.
I will dispute that beyond reasonable doubt.
Because the concern, to be honest with you, that I got, because I was thrilled to get a plan from you. My concern, having looked at it, is that, and yes, I want to agree with Mr. Rudy. We're talking about some outlier situations, and that's what I'm trying to get. I'm trying to focus on, A, how does Waterville addressing the outlier situations create a larger negative impact on surrounding communities or Delta, or does it not?
I think the concern is what I would call mission creep, is that it goes from a backup service to a full transporting service, and that's where the impact will come.
But that can't, so as far as, if Waterville were to get a backup service and keep it strictly limited to a backup service, that would not be a concern to you?
No, we would continue to work with the city of Waterville in that respect.
And as far as the plan, because, and I know you say we could tweak it, and maybe we can if there's time for discussion, because I have no idea how this council is going to vote tonight. The concern that Mike had brought up is that if the reason for the backup plan is that when we have these rarer circumstances where we need to get somebody right to the hospital, is that we have a firefighter or one of our first responders who's there, and you have somebody whose lungs are filled with fluid or is having a cardiac event, and there's still a 15-minute to 20-minute wait for your paramedic to be there. Because then they're just there, and it defeats the purpose of the backup plan. And they're having to have a family tell them, come on, let's go, you've got an ambulance here, and we're telling them, sorry, we can't drive it, your husband to the hospital or whoever it may be.
Right.
Again, I'm not trying to be belligerent,
No.
but that we've been presented with a lot of information over the last month now.
And EMS is not easy to understand.
No, and I'm trying to get to the heart of this.
So initially, our plan would require, as the chief and I discussed, a paramedic responding with that unit. The goal is to work towards what Maine EMS refers to as a response plan that we could implement within the city of Waterville that would allow for a lower licensed person to transport, and do that with our service license in the city of Waterville, so there would not be a delay. But initially, that would take some time to get into place. Rules are changing for Maine EMS. There will be some new requirements for the comm center in terms of using determinant codes, which essentially triages how a 911 call comes in. So there are calls that could be, there's always going to be calls that require a paramedic. But going forward, we could amend that.
Out of the surrounding communities that you have in this region, because you obviously serve this entire region, are there other fire departments or other municipalities, I should say, that act as a backup when you can't make it, that have their own ambulances currently?
The only fire department that has served as a backup for us over the years has been Clinton Fire Department in this area, and Augusta Fire in the southern part of our operation area.
Okay. You have a question? Okay. Do you want to wait till you hear from everybody else? Okay. Those are my questions for the time being. I'm going to open this up to others who would like to come and speak on this.
Good evening. I'm Steve Diaz. I live in Waterville. You get complaints about cars on the road on Merrill Street. That's where I live. We had our garage doors put in today, the worst day of the year. So, but so I
still did it, huh?
I still did it.
Service.
I've been with Maine General for 26 years. I'm a physician. I'm I'm the Chief Medical Officer for Maine General Health, the parent corporation. I worked in the ER for about 12 years, and I've been in the dark side administration for about 12 years. I'm also Delta Ambulance's medical director, so I heard some comments about my role in all this earlier. I have a long history in EMS. I was a medic before med school. I was the regional medical director before Tim Pay was, Dr. Pay. I was the state medical director for 9 years, and I was on the National EMS Advisory Council appointed by the Department of Treasury Secretary, which is the EMS National Committee to get a pulse on EMS nationally. So I'm pretty well versed in EMS. My comments have to do with a few vantage points. Delta, all in rural EMS, of which Delta is one, nationally, all rural EMS is under an onslaught. In the healthcare finance world, healthcare has not really got a raise in about 12 years from the federal government. That's Medicare and Medicaid, because they take the money away as they give it to you, which is why all hospitals in Maine are struggling and why rural EMS services are struggling. The payer mix in Waterville is reflective of that, is that probably 70% government payer for EMS runs and 10% no pay. And I'm giving you the finance side of this is because one of the ways that Delta is so effective is that we're able to cover a lot of towns with volume and thus staff up and keep busy. It's a small business model, right? The only way you stay in small business is to increase your volume and try to figure out how you're more efficient. That's why this plan might fill a gap, but knowing the exact gap that you're filling is important, and I'll get to that in a minute. Delta is one of the 2 EMS agencies in Maine that provide critical care level of service. Maine doesn't have a critical care certification in EMS, other states do, but the 2 services that provide most critical care for inter-facility transport, Life Flight of Maine and Delta Ambulance. The other part is I live in Waterville. As I've been here a long time, Delta has a good reputation, and not by chance. Dr. Pay, by the way, is an excellent EMS medical director. I helped train him. A lot of the EMS agencies in Kennebec County are covered by Maine General ER docs. That's what we do. So we all work very collaboratively. So this isn't adversarial. I'm saying the discussion here is very good. How do you get more for less? So it's very, very difficult. So no plan is going to be perfect. And if you wanted me to, I could poke holes in all the plans brought here tonight. But as a citizen of Waterville, my concern is twofold. Number one, you do have one of the highest quality EMS services in Maine, one of the top 2, providing service for me, my family, and all of you. Second of all, EMS is an expensive venture. And the equipment, the ambulances, the personnel, you have to reinvest in. And so I heard the chief have a really good plan out of the box, and I get that in the first year. But I'm thinking in 3 years, when you have to buy new ambulances, upgrade your equipment, healthcare technology is going through the roof. So the more you spread out that cost, the more it costs every individual patient if you don't have efficiencies in that model. So as you make your decision tonight, I would, if there's a way to get better data and you can actually have the metrics showing what's the gap you're trying to fill, what are the myriad of ways you might do it, and what's the 10-year financial forecast. Because as a citizen, I don't want my taxes going up in 4 years. And you might have to, if you buy 2 ambulances and staff it, and you find that your revenue stream isn't fulfilling that gap that you've expensed out, you're going to have a hard decision to make. And the hard decision will be how much do you raise the taxes. So I hope you discuss this. The other thing I just want to tender to you is, as I say, I'm the Chief Medical Officer of Maine General Health. My role is overseeing all our outpatient clinics and doctors for all our sites in Kennebec County and beyond. And I'm happy to be in any discussion, especially in EMS, if you're trying to get a handle on what the best way forward is. And I have already disclosed my biases, but that being aside, I do live in Waterville, and I want the best thing for my friends and family. So thank you very much.
Thank you.
I would just say, I mean, one of the things I asked the chief when we had this discussion over at the fire station is how hard would it be for us to get out of this if we decide it's not working for us? So one, that was why the committee, I believe, looked at used ambulances to begin with, because there's not as big of an upfront investment. 2, if we decide, we currently have a 1-year contract with the fire department. In order to add in order to get full on into the transport business, one, we would have to renegotiate our contract with the fire department, which is something that the city council would have to approve, including any additional budget needs. And so, the idea that this may, creep into an expense years down the road, that was a concern that I had. And I also had concerns about what effect would this have on the surrounding communities? What happens if we get into this business, we do move forward, we expand it, and it adversely affects Delta, and then all of a sudden you have all the surrounding towns that are in need of service, and so I think, that's something that is on our radar. I think that's not necessarily a discussion that we're having pertains to what we're talking about right now, but I just want people to know that that's something that we are considering moving forward. And I don't see a lot of risk. And I'm somebody who's very numbers driven. For anyone who doesn't know me, my degree is actually in structural engineering. And so when the chief pulls out a spreadsheet, that makes me happy. And, there's talk about a study, and I've been involved in a lot of different committees for the city over the years. I've never once seen a study that I thought was worth the money that we spent on it. And I also don't necessarily think that, as it pertains to this conversation, any outside party is going to bring any more information to the table than the chief has already gathered. Every concern that I had, every newspaper article that I read, everything that I mentioned, he already has it in his binder over there. And so, I just keep coming back to, I think, honestly, a study can tell you anything. The only way to really find out is to give it a go, and in the least risky way possible. And I think that's what we're looking at trying to do.
Counselor.
Yeah, first of all, I want to thank, first and foremost, the Fire Committee for being involved in these discussions and this dialogue with the fire chief and the Waterville Fire Department. And again, I want to reiterate the council's initiative here is to really do what's best for Waterville residents in the sphere of first responder status. I echo some of the same things that Eric has said and others have said. At the same time, I really want to emphasize the fact that Delta has to be a partner, and we have to respect them as a private business because we want their business in Waterville. I have seen the analytics with Chief Sean Essler. I have heard from the committee that was formed under my direction of forming that committee to investigate our emergency status and first responder status with the Waterville Fire Department and the resources and infrastructure that they currently have in maintaining and sustaining. Waterville Fire Chief Sean Essler has portrayed amazing analytics and statistics on the sphere of having these used ambulances and what they can bring to the Waterville as far as a backup service and to increase first responder status. I want to say first and foremost on behalf of my constituents and the residents of Waterville, because the perception out there that has been driven is that the money that was the $113,000 that is supposedly going to be invested into these two used ambulances is going to raise taxes. In no way is that true. This is money left over from the purchase of this hybrid ladder fire truck that we have gone out for bid and is part of the bond money. And this is a savings because that truck came in better than expected. Any money that is left over from the allocation of purchasing that fire equipment is designated to be, again, towards fire equipment and towards the fire department. So this fits under that umbrella as far as the bonding is concerned. I can't think of anything more critical than enhancing emergency response status as far as Waterville residents are concerned. I do want to speak, though, on constituents and residents of Waterville that have, and even business people that have reached out to me, their concerns of us going beyond a backup service. I do not support going beyond a backup service. The committee does not support going beyond a backup service. The council doesn't support going beyond a backup service. We want to be partners. We want to be partners with Delta. We want to be there in those slim amount of times and those occasions that are life and death situations. We want to provide the Waterville Fire Department with the infrastructure and resources they need to get the job done. It is in our best interest as a council and for the Waterville residents to make that happen. The passion that I hear on each side of the aisle with the Waterville Fire Chief, Tom, you know, Mr. Beals from the Delta, I have great respect for all of you guys. Constituents on the ground that I have knocked on doors and had conversations with, fixed income and senior citizens have an incredible loyalty to Delta. And they have spoke very highly of the Delta apparatus and system, and they want to stay with Delta. You know, the assurances from, I can tell you that that assurance is for real. We want Delta to be the primary transport service in not only Waterville, but all outlying areas. We do not, you know, we do not want to jeopardize that in any way. And the words from Mr. Beals with the concern of being mission creep, I can understand him raising that concern, you know, with his business. Because any businessman would want to raise that concern, and the board of directors as well. I'm a very pro-business person. Every vote that I take on this council, if you go back, I'm all about being about business and enhancing that and moving ahead with development that helps not only the business, but also helps the outlying factor of residents and constituents and putting back into the local economy. It is my opinion, looking at the Delta proposal, that it does fall a little bit short, as been raised with the paramedic status. I do believe if we maintain and sustain simply, this is about a resolution to purchase 2 ambulances. It doesn't go anything beyond that until we agree to do other things. I was on the fence a long time, for quite a while, because I wanted public transparency about this issue, as did the mayor, as did several other people, because I feel like the public needs to have input on this. It's very important to hear from all facets and all different avenues of business people and residents and concern, even the medical field, on this issue, and I think we've seen and heard a lot of that so far, and that should continue. I am very much supportive of expanding the fire committee, having private citizens come on it, have specialized people come on it, and that work should be ongoing. But in no way do I want, and I don't feel the council wants, us to look at these ambulances and the backup service as being subsidized by Waterville taxpayers. I'm totally against that. If the revenue line isn't there, as the Waterville Fire Chief has very much construed, then this venture will end. It will not be tax subsidized. It will be, if the revenue line does not maintain and sustain this type of service, we can get out of it as fast as we get into it. And that is paramount in my mind with my ward, and I know other councils have similar views on this, but we cannot look at this as a subsidization from taxpayers to move this ahead. We have to venture into this carefully and methodically, and if we do go into a transport business of any type, an outside agency, independent agency will come in, and we will invest in that before we do anything, and we will be very careful and methodical about what we do. And with that, you know, I am in favor of the purchase of these ambulances based on all the data and statistics that I've heard. And of course, the generous outflow of conversation and dialogue that I've heard on the streets from business people and what I've seen before me with the presentations and conversations amongst all of us. So the adversarial type of perception, I can't say enough. We want to be partners with Delta. We do not want to invade or explore taking away anything from the Delta apparatus. They're very much appreciated in this community and the outlying communities, and we have to be very careful about what that is all about, because that is very important. And also, it is also very important that we take care of our own, as Waterville Fire Chief Sean Essler has said, as council members have said, the committee has said, and that's where I stand on that. Thank you very much.
Mike, and I don't want to carry this conversation on too much longer, but I want to make sure, and if there's members of the public that have questions or comments, I want to make sure that they get up here as well. Mike, you said that you thought you would still like some more time. Originally, I had asked for more time. It's been almost 2 months. What conversations would you see transpiring if we were to give it more time rather than make a decision tonight?
Well, I've said from the beginning that I don't think this is just a one-part problem. I think it's a two-part. I think there's a short-term problem, and then there's a long-term opportunity. The short-term problem is adequate response time by ambulances. The long-term opportunity is, and which I believe will follow, should the city buy ambulances, it will follow. How long it will take to get to that point, I don't know, but I think that a transport thing will follow at some point. And so when are we going to look at that question and understand all the ramifications about it? Are we going to wait for it to happen as we did this one?
I certainly hope not, but I think we've been given that commitment by the chief and the committee that that wouldn't happen that way. Because I will be very honest, I'm the one who vetoed this. I asked for certain things to happen that I feel have happened. However, and I'm certainly not in favor of expanding to a full-blown transportation service. That happened in Presque Isle. It killed the regional ambulance service. It caused all kinds of problems. It's not something I want to see here. But to be intellectually honest, I have to deal with the situation that's in front of me, and what's in front of me is a backup service. And what I'm looking for is for anyone to give me a reason why I shouldn't just recommend to the council that they override the veto at this point, because it doesn't seem like I'm getting anything that says that that's a bad idea at this point to go with the backup plan. I can't ask them to sustain a veto if it's strictly because we're worried about what will come down the road next, when that is going to necessarily require another public process. Is there anybody who can explain to me why we should not do a backup plan? Claude.
Well, surprisingly enough, my first statement of substance at the council meeting is going to be to support the mayor's veto. Every time I've heard somebody talk about this, something new comes up. The chief came up with several things that we didn't talk about when we spoke the other day. What we've heard from Delta has been information that I was unaware of. It seems that every time I turn around, and indeed the first thing that I get hit with when I become a counselor is buying ambulances. I disagree with Mr. Mayhew. I think that we buy the ambulances, we're jumping right into ambulance services. I disagree with Councilor Colello, who thinks this is a wonderful opportunity to get revenue for the city. It's not. This is a money loser. The city is going to end up raising taxes to support ambulance service. Therefore, I don't see any reason why I should dispute the mayor, who very reasonably said, let's think this over and get all of the facts before we leap in the. So I'm going to support the mayor's veto.
Okay. Yeah, we will open it up to the public. And Chief or Tim or Nate, if you guys want to jump in at any time, I want you to feel free to do so because you are our resources here tonight.
My first question would be for Cindy Mayo. Was this money given to
All
us?
questions must be directed to the chair.
Okay.
Your question will be directed to me, and then
Yes.
we will call on
Was
council.
this money given to us to purchase the ambulance, or was it borrowed?
This money was borrowed in our most recent bond.
So is there a payment required?
There will be, yes.
So you said taxes won't go up. So are we saying the city has a surplus of extra money?
No, but we can't, there is no prepay option when you do a municipal bond take like that, and so it does have to be spent on something of comparable life, something that's comparable to what we told the bondholders we were going to spend it on.
Can the money just be returned?
No. I've asked that, trust me. I think actually everybody up here asked.
That's all I got.
Okay,
Questions. Thank you.
thanks, Chris.
Julian Payne, Ward 5. That 150,000 for the 2 ambulances, I understand it's bonded. Can that money be reduced to lower the mill rate if you don't buy the ambulances?
No.
So there's no way to get that 150 back now. You've already bonded for it.
Correct. It would have to be, it would have 113. It would have to go into comparable equipment.
Right, because a bond, the person who bought the bond, it's an investment. And then when they make that investment, they have certain expectations about the return on that investment. So you can't just turn around. It's not like buying a car where you just turn around and say, well, I'm going to pay it off in advance.
Would comparable equipment be Parks and Rec equipment, snowplows?
I had a lot of those complaints today, trust me.
Yeah. So my concern is the comment about misinformation. When people go into an argument, there's usually misinformation on both sides. That's just the way it is. Look at the Brexit.
Fair enough.
I thought the newspaper was very fair in reporting on this article. My whole concern with the process was the fact that it seems to have bypassed the city manager's responsibility in this. You as a council voted to renew his contract. It should be the city manager who decides on whether this is viable and then proposes it to a vote. The same way that employees of the city manager, like the fire chief, should have dealt with this with the city manager behind the scenes. Now, I'm not speaking as a school board member, but if I have a concern, if a school board member had a concern or problem with a school, they would go to Eric Haley. They wouldn't go to a school department. We wouldn't go to a principal and start cutting deals and negotiating facts and figures. We would talk to Eric Haley. If we didn't like the way we dealt with his decision, the school board would then not renew the contract. So a lot of this confusion and 2 months drag out seems to be that they bypassed the city manager and the departments. And I think it's a lesson to be learned for the future. He's the head. You vote on what he says. If you don't like a city manager's decisions, you vote them out. It gets rid of a lot of this 2 month drag on.
So I'm going to clarify something here. The city manager reports to the city council. However, according to our charter, the council nor the mayor has the right to go to department heads or city employees and tell them what to do. That has to go through Mike, who
Exactly.
is the CEO of the city.
Exactly.
So you are correct in that sense.
And that's just common sense that would apply for any organization from a school board to the city. And I think that if it had gone through the city manager and not through council and department heads, we would not have been in this 2 month mess. And hopefully it's a lesson. There's lessons. It's the same thing with the recycling, the dual packer garbage truck. There's a black and white way to do it, and it cuts a lot of problems down. Thank you.
Thanks.
Judy Cabana, Ward 2. And believe it or not, I'm a senior citizen.
No way.
And I have had a lot of dealings with the ambulance service over the years and never had a problem, always was there on time and in a quick manner. And when I ask them to use no sirens, they don't use any sirens. And I think it's a better thing to wait, and I agree with the veto. and I think we need to look into this. I know you've looked into it a lot, and you've done a tremendous job on your reports. But I think we need to have more time. Thank you.
Kathy Weeks, Ward 1. I have 5 points. Number one, Mr. Roy, I totally agree.
Kathy, for the sake of our new and improved following of Robert's rules,
Yes.
I'm going to ask you to direct all commentary to the chair. Thanks.
I agree with Mr. Roy that he should have been involved in that in the beginning. This is not a disrespectful comment, but nobody that sits on this council is in healthcare and an expert in delivering healthcare via, if it's the ambulance or whatever. And to have 3 people rush that through, that was not done correctly. Dr. Diaz, I have a degree in healthcare administration, and everything that the physician has said tonight about reimbursement, and I don't think anyone on this council is an expert in healthcare reimbursement. He was right on the money with that. There is no reason to hurry through this. Councilor Frankie, I totally agree with you.
Over here, Kath.
I'm sorry. I was not trying to be disrespectful.
And folks, unless you think I'm being rude to Kathy, and
No,
Kathy and I have a great
no.
relationship,
You are
we
correct.
have all directions comments because that way it doesn't ever allow for somebody to turn into something personal.
That's correct.
Yeah.
That's correct.
Yeah, thanks.
There is no reason to rush into this. I have dealt with Delta for 12 years with severe, severe illness, cardiac, and strokes. And Delta has always provided care that you would receive at Mass General Hospital. So please, I am, as a resident and as a concern about increases in taxes, because the statements were wrong. Yes, you buy the ambulance, but then there will be staff, maintenance, everything else on the 10-year plan. So I am imploring that you wait and talk with healthcare professionals that know about all of this. Thank you.
Chief, can I clarify, specifically for the backup plan, would you be adding any staff?
No.
Yes, sir.
Good evening, Mr. Chairman. I'm Ronnie Rodriguez. I'm the fire chief at Winslow.
Welcome.
Thank you. I also have 26 years working in Fairfax County Fire Department, which is right outside the nation's capital, and it is a fire-based EMS system there, so I do know that it does work. To answer your specific question, is there any reason why a backup plan wouldn't work? I think the chief's plan is right spot on, and I'm here to offer my support to him. I think it's well thought out, and I think he's a bright young man. So, from my perspective, I am in total support. The things that are being seen here in the city of Waterville are also being noticed in the town of Winslow and the surrounding areas, and this is not to put down Delta. They are fine people, but as the chief has mentioned, we need more workers, and through the fire-based EMS system, we're able to provide those workers. In fact, through grant funding, we've increased both in Waterville and in Winslow, and I want to say some members of Fairfield Benton have improved their EMS license to the advanced. Winslow has secured another grant, and we will be sending 5 of our personnel in addition to, I've opened it up to Waterville to send one of their personnel to the paramedic program at KVCC. So from a fire service standpoint, from a governmental standpoint, we are trying to do as much as we can at a minimal impact to the taxpayers by way of securing grant funding for the things that we're doing. We just received the cardiac monitors. The grant money for that, there are things that we are doing to minimize the impact to the taxpayers while improving the service delivery to the citizens. So I just want to offer my support to the plan that Chief Essler has put forward.
Okay.
I just have a question for it. And for the record, you are the fire chief in Winslow.
Yes, sir.
Okay. And only because, again, we discussed it, Vassalboro EMS is against our backup plan. You're saying that it's a good idea.
It is.
Thank you.
Thank you.
Thank you.
Thank you.
Counselor.
I just want to address this issue, this idea that this was sort of rushed through. First of all, Chief, this is something you've been working on for quite a long time, correct? Correct me if I'm right, 10 years? 10 years.
But I've been really working on it over the last year as a result of what I've seen in the field.
With all due respect, the public that we serve here in Waterville has had a month and a half.
I understand. I just want to make sure that they understand the people who gathered the information and looked at the information have been. This is a conversation that started, to my recollection, during budget time. So it's a conversation that's been going on amongst counselors for 8 or 9 months now, and that the committee was the committee was only formalized 3 or 4 months ago. And so it may seem like they rushed to a decision. I just want to assure people that, it was a much longer conversation that got us to this point than just the meetings that the committee had.
Any other members of the public that would like to comment on this? Mr. Lee?
Yes. Can you hear me?
Yes.
Okay. If it is the council's inclination to override the veto, I think it's extremely important that you maintain the integrity of the bidding process. Used ambulances are not unique. And you're talking about spending over $100,000, and you have not sought out all the available bidders for this because, quite simply, there was no publication, there was no competitive bidding process. So if your inclination is to override the veto, I think it's important long-term to make sure you maintain the integrity of the process. And so if that is your inclination, what you could do is, rather than taking a straight up and down vote, there could be a motion to amend the resolution to state that the administration is directed to seek competitive bids for the purchase of 2 used ambulances, and if that motion passes, then this goes out to competitive bidding, and then you'll find out maybe you did get the best price. On the other hand, maybe you come back with something that's $20,000 less. I just think long term, if you bypass the bidding process here for used ambulances, the exception swallows the rule. That's my point. I make no comment whatsoever in terms of something from a policy standpoint, whether you should be doing this or not. That would not be my role.
So a question for you is, 2 ambulances with the same chassis, same motors, under 100,000 miles, both painted red, is not a unique purchase?
No. And you'll find out what the level of competition is if you put it out to competitive bid. But a used motor vehicle is not unique. Go on the internet. You can get there are a dozen different sellers of these, and they've got dozens of different ambulances. It may be that this is the best price, but then you'd find out following the ordinance, which has been adopted by this city, which legally requires you to do that. Now, you having heard what I just said, of course, the council can ignore it. But I think you need to take a look at the long-term picture here, because we have, for generations, had a competitive bidding process, and if it's more than $10,000, that's what you're supposed to do, with very rare exceptions. That's my point. Whether you should buy them or not, I'm not going to make any comment on. That would be beyond anything I should be involved in.
It's well taken.
So procedure-wise, if the city council was inclined to amend this, what would they amend Resolution 197, 2019, would they vote to override the veto first and
No.
then? No.
They just moved to amend, it's back before you for reconsideration. So it's in the position it was in before you actually voted on it. That's what it does. You vetoed it, puts it right back for essentially its first and only reading since it is a resolution. And at that point, which is now, council's free to amend it as it may wish, which is what has happened, for example, when we had a veto of the budget. We had a veto, and then the council came back and decided, okay, we're not going to try to override it. We'll cut out a certain amount of money. They made a motion to do that, amended, it passed. And of course, that action would have also been subject to a mayoral veto if the mayor had chosen. But when that happened, of course, I believe it was acceptable to everybody. So in this case, if that's your inclination, you just make a motion to amend to state that this goes out to competitive bidding for 2 used ambulances.
And Chief, you have indicated that you
doesn't-
have these spec'd out and you're ready. You're ready to go to a competitive bid. Chief, he needs a microphone.
Yes.
And I assume if you did, you'd be looking for such criteria as
So
same chassis, same
The
motor.
city manager and I actually worked on this together, because I asked him, how do you want us to put this out to bid? Because I got to be honest with you, I felt that it was pretty unique. I mean, these are custom trucks, buying 2 of them. So when the committee asked me, what's your opinion? I said, well, we're not buying 1, we're buying 2. They're matching the chassis, they're matching a lot of different ways, painted red, meet all the specs, but the most important component of that is the service. The trucks they're great to buy, but what's more important is the service of those trucks. So we require on all of our trucks that it is published in the paper, normally, like Bill says, that we have a service center within 100 miles of the city of Waterville. And that saves money in the long run and makes sure that those trucks stay on the road. So the short answer is, yes, we have that designed, and it very easily says 100 miles of service, red, so on and so forth. So yes, we have it ready to go.
Would the council like to amend or would the council like to vote?
I have a
Yes.
quick newbie question. If we put it out to bid, what's the timeline for the bidding process?
I'm not, yeah, go ahead. I'm not sure we can do it by the next meeting, but.
So when we originally discussed it, we talked about coming to this meeting. I believe the policy says 10 days. Correct me if I'm wrong, Bill. I think it's 10 days. The only problematic issue that I have is I'm going on vacation after the 12th. It's be the first vacation I've taken in probably 5 years. So if it comes to the next meeting, I won't be here, which is not problematic for me. But I would like to have that deadline before the 12th of December, if possible. So doing quick math there, that wouldn't meet the 10-day requirement. It might be 5, but I'm sorry that I'm speculating. I just don't know.
I think it could come before you at your next meeting if we go out to bid. I'm not sure about amending a motion. The thing on your agenda is to override or not. After you take that vote on overriding or not, if it's clear from council that you wish us to go out to bid, we'll do that. You don't have to take a vote on that.
Actually, they do, because if they simply override the veto without an amendment, it's to purchase.
Correct.
You've been given instructions to purchase.
Yes. True. But we can put it out to bid, too.
To make it official, I would like to make the motion.
Counselor.
I would like to make the motion to amend based on that I feel like we should leave no stone unturned, and I would recommend that we do that.
Is there a second? There's not a second, so we are now going to go to a vote on the override. And can we get some clarification, because it's important that the council understands the yays or the nays on this one. To override the veto is a affirmative, correct? And that would then put this into motion, and the ambulances will be purchased. Okay? That's a yes.
Yes. That's the way it's worded.
Okay. Is the council prepared to vote?
Yes.
I think everybody is.
Yes is a override.
Yes is an override. All right. All in favor? Opposed? 6 in favor, 1 opposed. Next, we have ordinance 201, 2019.
Move to read by title only.
All in favor?
Is everyone in favor of title only?
Yes.
Yes.
An ordinance providing for amendment to the property maintenance ordinance.
Move to adopt.
Second.
Is there any discussion among the council?
So we discussed at the last meeting that I have at least 2 vehicles at my house, that one we're going to be restoring, the other one is going to be for my current 16-year-old kid. And in the ordinance, it says 1 or more unregistered vehicles. Is it still that way?
Well, nobody's offered any amendments yet.
I'd like to offer an amendment to change that to 2 motor vehicles, like road vehicles, because some of us own 4-wheelers, some of us own boats, and there are times throughout the year that those are not registered. So I want to be clear that we're talking about automobiles. And I'd like to propose an amendment that it be at least 2.
Do you need specific language?
I'll get the nuance, and I can certainly put the language in, and I can check with you if I'm not clear on what it is.
Short of that, that's all I care about.
So do you want to state your amendment again?
So I would like to amend to allow for no more than 2 vehicles to be unregistered, but those are motor vehicles that drive on our streets. Boats and ATVs are not included in that.
I just want to go to this section to.
But what if somebody has,
I have some copies.
just to be clear, so you can have 2, because my thing is like, yeah, I mean, somebody could leave a boat or a camper, old broken down camper in their yard, and the neighbors are looking at that for 10 years.
Correct.
That's not desirable either.
No.
Right. It says, what it says is 1 or more unregistered or uninspected vehicles.
I would just like to move that to 2. Leave everything else alone.
So you just want to change it to 2?
Literally, 2.
Is there a second on that motion?
Sit simply on a vehicle and not anything else.
That's what's being-
Well, I mean, Jay, I'm sorry, what are your definition of vehicle remains the same as in boat ATV? So are you saying 2 vehicles, or do you want to strike the word vehicle and say 2 automobiles? But then again, what if that's a boat and an ATV?
I'm good with vehicles in general. So if I have a boat and a car unregistered, or 2 cars unregistered and uninspected, or 2 boats, or 2 campers, 2 would be that limit.
So was there a second?
I'll second that.
Is there discussion on the motion?
I have a question for the city attorney.
Eric knows which section it is. Which section?
Section 2. The bold section at the very end.
It's in the middle.
It says 1 or more.
Got it?
Yes, my question is, when it comes to enforcement of an ordinance like that, is that the code enforcement officer who would do that?
Yes.
All right. Then my second question is, what's the procedure to get an exception to the code? Is there a procedure?
No. I mean, if you make this amendment and therefore have 2 or more unregistered or uninspected vehicles, and a neighbor makes a complaint, the code enforcement officer would require the homeowner or renter or whomever to comply with the ordinance, and gives them a period of time to come into compliance.
And my final question is, what's the ultimate remedy for the city to enforce the ordinance?
Take them to court.
Find them, yeah.
Was there any other discussion on the motion? Or the amendment, rather? All right, we're going to vote on the amendment. All in favor of the amendment? Oh. No, this is for an amendment.
Just the amendment.
This is for a specific amendment about vehicles. All in favor of the amendment? Opposed? So that was 4-3. Flavia was a nay,
Okay.
But the amendment passed.
but the amendment passed.
I will move the ordinance as amended.
Second.
Okay, discussion from, any questions or discussion from the council on the ordinance?
Flavia, I know you had a concern. Did you want to, were there amendments that you wanted to offer as well?
It was just some of the wording, even on like.
Just speak into the microphone.
Section 2, like they're actually mentioned the structure. We actually have like peeling, paints and stuff like that. Like, it's like, how can you measure that?
I would just say that's all, it's all in the current ordinance as well. In fact, the current ordinance goes into a lot more detail about those types of things.
But that goes into detail more of a like vacant home, but not like your actual home.
The current ordinance applies to occupied properties as well.
Yeah, but it doesn't have this wording because I read it.
What section are you in?
Section 3.
Section 3. And just to be clear, Counselor, your concern was with the peeling or deteriorated paint?
Yeah, that second paragraph.
All of it or just that part of it? Because
Especially the peeling, like paint peeling.
But are you okay with us being, regulating broken glass and
Yes,
missing shingles?
Yes, definitely. Yeah, the safety, yes.
So do you have an amendment you want to offer?
Yeah, just me taking that peeling paint off.
Is that a motion?
Yes.
Is there a second on that motion?
I'll second that.
Is there discussion on that motion?
That be to delete the words "and peeling, scaling, or deteriorated paint"?
Yes.
Okay.
Is there any level at which you would find it appropriate to demand somebody paint their house?
That's more looking at vacant houses.
But what if I have somebody living next to me and their house just looks, it's starting to drag my property value down because they've needed a paint job for 20 years?
Shingles, we still have the missing shingles. We still have stuff there that you can call on.
So, and I'm not trying to be, again, I'm just trying to clarify, there is no condition in which you would address the paint of someone's house?
I would just make the point that that's something, I went through this with a friend of mine. His insurance company made him paint the house before they would insure him.
So then that's good.
Yeah.
Leave it at
Thank
that.
you.
Let the insurance company.
Yeah, because there would be lead. That would be a goal in them.
I understand the concern. It's a very difficult issue to where do you draw the line, and are you going to find somebody, what if they can't afford it? You know, getting your house painted is not cheap. You know, I don't know. It's a hard discussion to have because I certainly don't want to be in the position of taking somebody's home away because they can't afford to put a paint job on it. But at the same time, that's sort of what you sign up for when you move into a city and you have neighbors.
Can you say, sorry to interrupt you, but can you put maybe even a time limit on it? Like how many years or a year where it has been completely unaddressed? Is that a thing that we can do or no?
Can amend.
Well, I mean, the code enforcement officer, of course, has leeway when it comes to these issues. I mean, this is not the paint issue, but if you look at what's been going on in Fairfield with the gentleman who's basically running an unlicensed junkyard, and they've been trying for years and years and years to get him to clean it up, and they keep making deals to give him time, more time, more time. And I think it is something that, and ultimately, they have the recourse of going to court as well. But I just think you start removing some of these things and you're taking the teeth out of the ordinance altogether.
But that's what we did to the original, though.
And it's really, all this stuff is complaint driven for the most part. The code enforcement officer is not driving around town looking for peeling paint and giving people fines. I think it has to be to the point that the neighbor is complaining about it.
Councilor Mayhew?
Yeah, I would have to agree with, I don't mind Flavia taking out the peeling, but I think we should maintain some kind of ordinance with some kind of bite with deterioration of a structure that is inhabited in neighborhoods. I mean, you can walk down any street, even in my ward, and I get complaints from constituents all the time about what the house next to them looks like. And the main complaint is, look what it's doing to my market value of my home. Nobody wants to buy my home if I'm next to this blight. And a blight can be inhabited. It doesn't have to be a vacant building. So I think there has to be some kind of ordinance or some kind of standard in Waterville for our neighbors and for our constituents. If they complain about something that's tearing down the fabric of their market value so that they're not able to sell their home, people need to be brought into compliance. So I do favor some kind of bite.
By the way, does this apply equally to public housing?
All housing, yeah.
This applies to all housing, so we're expecting Waterville Housing Authority or any other housing project that is going to be kept to the same standards that we're asking our homeowners?
All properties.
Okay, just want to make sure.
Yeah, so.
All right, is there any more questions or discussions? The motion on the table is to remove peeling, scaling, or deteriorated paint. Is there any more discussion on that particular motion? Yes, sir.
Just quickly, I think what Flavia is driving at is this ordinance is, while Councilor Mayhew thinks it's a matter of helping out his neighbors, we're actually asking the city to use its governmental power to force somebody to do something. So I think it's a matter of what do we want the city to start to strong-arm employees about. And I think peeling paint might not be one of those things that we want to. So I'm going to vote for Flavia's motion.
Is there any other questions or comments on the particular motion on the table?
Can we remove just a peeling and keep scaling and deterioration?
Okay, we can add a timeline, like a certain amount of years.
I mean, I'm looking for a compromise here.
That is a compromise.
Can we make it within?
Are you ready to make that motion tonight? Because I guess what I'm looking for here, we're looking for specifics here. What is it? Because there is a motion on the table to remove peeling, scaling, or deteriorated paint. If there's an alternative to that, let's present the alternative.
Alternative would be 1 year? To add a time limit to this?
Bill, what's the procedure? Do we make a motion to amend the amendment?
Well-
Or do we vote on the amendment and then
You vote on the amendment unless the opponent of the amendment is willing to withdraw it to be.
offer a new amendment?
Right. And also caution you, don't try to put a time deadline. It's who's going to say how long it's been unpainted. You put the code enforcement officer in probably an impossible position for
Well,
enforcement.
and he's not going to be able to go back a year later. Oh, well,
Yeah, right.
Joe Taxpayer on Elmwood Street, it's been a year since I checked his paint,
Yeah.
Probably not going to happen with the workload he's already got. So, yeah.
Those conversations would happen with the initial complaint saying, my neighbor, I've been looking at this house forever, and what can we do about it? Dan then starts this process and goes and talks with the homeowner in question, which then starts this whole ball, which is very similar to what we did. I mean, granted, the home was vacant on Western Ave.
Yeah, right.
But we've had this conversation, and that went on for years, and
Which could only happen by leaving the paint in. If
Right.
you take the paint out, you can't talk about the paint.
right.
Is the council ready to take an up or down vote on the amendment? Yes. Okay. All right, Counselor? Hang on, if first of all, any commentary should go to the microphone, please.
Oh,
so
no,
everybody
'cause
can-
what I was stating is like the missing shingles, the long grass, all those stuff will show that the house is not being taken care of. So we can come in and all, but I feel like a peeling paint, I mean, some people see it as art. Like,
Well,
you never know.
Well, I mean, as a homeowner, I can put a roof on my home because that protects the inside of my home. The outside, not so, I mean, I can put up tie power and it'll keep the elements out. There's nothing that says I have to replace it with, any type of siding. So when I'm next to somebody that decides to go that route, I'm now looking at something that says, Home Depot, Home Depot, Home Depot versus either paint, clapboards, or things of that nature. And I think that doesn't solve, I mean, I have a brand new roof now, so I don't, the roof is upkept, but the outside of the house isn't. If that's the concern, you know what I mean? If that's my concern as the next door neighbor, then
Okay. All right. I'm gonna call for a vote. All in favor of the amendment? All opposed? The amendment fails. Mayhew and Morris. Is there any other discussion from the council on the rest of this ordinance? Okay, we will open the floor to the public. Yes, sir.
Ernie Grolleman here, Johnson Heights, Ward 2. 3 minutes, please, on the proposed property maintenance code. This proposed property maintenance code is unsafe. The Maine Public Safety Department agrees. Therefore, this proposed code is unconstitutional. It removes required prohibitions against 1, smoke, 2, toxic gases, 3, noxious odors, 4, excessive particulate air pollution, and 5, health nuisances from the existing code. Therefore, the existing code should be kept. It is recognized by 70% of the cities around the world as the basic teaching of the code profession, which the U.S. Code of Ethics requires all politicians to accept. The legal profession also recommends it. The National and State Fire Code prohibits all smoke and toxic gases too, so you must keep the old code or add the required prohibitions. State statutes prohibit all noxious or unhealthy odors, such as wood smoke, so you must prohibit noxious odors. The Constitution also establishes English common law as our base law, and it prohibits noxious odors and threats to health and safety. So constitutional law is against this, with judges writing, "Safety is the supreme law." Judges also write that health nuisances must be stopped with no discretion for not enforcing the laws. And not enforcing the law is a crime per the federal criminal code, with state officials agreeing home rule has a lower priority than statutes or constitutional law. All of this rests on new science accepted worldwide, which has been put into new codes and laws worldwide. All smoke you can see or smell causes instant inflammation in the eyes, lungs, arteries, and brain, and all over the body. This is instant inflammation.
The smoke from one cigarette causes unsafe fine particulates, and wood smoke plumes have been monitored at similar concentrations. State officials agree the smell of wood smoke is common, indicating cities are not enforcing codes and laws to stop it, which is a crime.
That would be your timer. Ernie, so I have a question. So just to be clear, to clarify some of what you're saying, I have 2 wood stoves. Are you saying they are unconstitutional for me to use those?
They're unsafe. They create unsafe smoke. The new science out here that's coming
you threw a lot at me,
from
so
the
it's fine.
DHS, the Surgeon General, the EPA, and everybody, it's not questioned at all, is that all smoke that you can see or smell is unsafe, and that violates constitutional rights to safety. And safety is said to be the supreme law. It's a health nuisance, a public health nuisance, according to the DEP air chief that I've been talking to.
Right, but if you burn your fires hot enough, you won't see that smoke. I'm not being belligerent here. I'm being honest. I mean, if you go by my house when I have these things ripping to like today, you're not going to see anything except for like, you know, the wavy air from the heat blasting out of the chimney.
I see it all the time, and I smell it, and the smell is absolutely obnoxious. And it makes me sick instantly. It causes instant stinging eyes.
So what about if your neighbor's and again, these are not belligerent questions, but I'm trying to put some greater context so I know exactly what we're talking about. Especially in cold weather, your neighbor's barbecuing. You throw those ribs down. The whole neighborhood smells amazing.
Amazing. I think it stinks, and it's terrible.
So we shouldn't
It's
be allowed to use
sickening.
barbecues outside. Is that along the lines of what you were
What the
stating?
deputy director of the ATSDR told me is that all smoke is unhealthy. They started investigating tobacco smoke, and they opened people up, and they saw all this black junk inside the lungs, and it was carcinogenic, so the Surgeon General had to make statements about smoke, and then it was extended to secondhand smoke, and then they had wildfire smoke studies done, and they found the same problems with that and diesel smoke, all smoke, including barbecue smoke. And one of my neighbors was getting so mad at me, he put a meat smoker 20 foot away from my house, right where the wind was blowing it onto my window, because he was mad at me. He could have killed me or my daughter. My daughter had asthma attacks all the time.
Excuse me, can we have some order in the audience, please? Excuse me, sir. You are out of line.
Also,
be respectful, or I'm going to ask you to leave, sir. We have a speaker here, whether you agree with him or not. He has a right to be here. We are engaged in a conversation, and we're going to listen to what he has to say. And I've asked him some questions, and he's answering them. I don't agree with him, but he has a right to be here, and I've asked him questions, and he has a right to answer them. Thanks.
Also, some of my neighbors have had heart attacks. And smoke causes heart attacks as well in short periods of time. And there's also a problem with excessive particulates as a generalized air pollution problem from new science coming out of the EPA.
Okay. Is there anybody else has a question for Ernie? No. Thank you.
I'll be brief on the smoke.
Hang on, Councillor Thomas would like to speak.
Bill, if something's in the state fire code, anything we can't do anything to override the state fire code, correct?
That's a pretty broad code, so I'm not going to be able to make a blanket.
But generally
answer your
speaking,
question.
if there's things in the code about nuisance, smoke, chemicals, gases, that's covered by the state.
Right. We're not trying to change any of that when you adopt this ordinance. You're adopting an ordinance which covers just certain aspects of the management of property. I asked the code enforcement officer with this shortened ordinance to check available state statutes for his enforcement ability in a wide variety of areas to ensure that we weren't eliminating the powers that he presently had. And there were a couple of changes made to this as a result of that, but generally he said no, he felt comfortable after he had done that search.
Mr. Payne.
Yeah, it's difficult to regulate the smoke. I mean, I sit in the hot tub with a big cigar, and there's smoke blowing everywhere. And you know, I let my beautiful standard poodles out in the yard today, and there was a lot of methane gas coming out, and there was a lot of bad, obnoxious smoke coming out the back end. And those two dogs have a right to do that in my yard. So thank you.
Any other questions or comments from the public on the property maintenance ordinance? All right, I'm going to move this to a vote. Patty, can I get a roll call, please?
Yes. Counselor Morris?
Yes.
Counselor Oliveira? Yes. Counselor Smith?
Yes.
Counselor Mayhew?
Yes.
Counselor Coelho?
Yes.
Counselor Frankie?
Yes.
Counselor Thomas?
Yes.
The vote is 7 in favor and 0 opposed.
Moving on to new business, Resolution 215, 2019.
Move to read by title only.
Second.
All in favor?
Authorizing the renewal of liquor licenses expiring between January 1, 2020 and March 31st, 2020.
Move to adopt.
Second.
Any discussion? All in favor? Resolution 216, 2019.
A resolution providing for regarding renewal of parking permits. To see what decision the City Council wishes to make regarding an extension of parking permits issued for certain customers of the Yard Goods Center.
Are we still dealing with this?
Is there a move to adopt?
Move to adopt.
Is there a second?
Second.
Discussion? Counselor?
I mean, the original intent of issuing these temporary permits was that the parking committee would come up with a long-term solution. So I just don't know how long we can keep kicking the can down the road on this and just renew these permits, which is playing favoritism for one business, without coming up with a more permanent solution that broadly addresses the concerns of the other businesses as well. So I guess at this point, because nothing seems to be happening by just renewing these permits, I would be opposed to renewing them.
Can we amend this?
The only thing I would say is I think at this point, nothing really can happen until the City Council votes on the actual plan for the redesign for the concourse. I could be wrong, but
There are things that could be done. I mean, some of the spaces that are currently 2-hour parking could be reassigned to long-term parking. We could add more handicap parking spaces over there. We could come up with some sort of a procedure by which you can apply for temporary permits, by which other businesses could apply for them, and it just seems that none of that's been done.
I agree, and I think it's disappointing that the parking committee hasn't addressed this more long-term. Yes, Councilor Mayhew?
Well, the parking committee did meet, but we didn't have a quorum, right, Mike?
Correct.
The outstanding issue with Yard Goods is that, again, we're going to a long-standing business that has clientele that is elderly, and that's been a long-standing fixture in the community, and we need to be concerned about that. We haven't been able to find, this has been a moving object, obviously, to try to remedy this. There's not really a concrete remedy to this, especially with the concourse redesign that's going to be coming up soon. And yes, I do agree that it does show a little bit of favoritism to one particular business. I'm not sure if not renewing the permits is going to have a detrimental effect to the Yard Goods Center. I mean, it really sends a strong signal to this business and to the owners. They're going to come back in here and they're going to ask why. Why is the animosity of the council towards us, not permitting us to happen? We have to, like I said, there's a number of things that we could do. We could reallocate parking to more all-day parking. We could create a signage that says 3-hour parking instead of 2-hour parking. All of those things have been flipped upside down and around, but we haven't been able to make a concrete decision on this. Mike, do you have anything you want to add to that as far as your perspective on Yard Goods?
Well, their permits expired October 31st.
So we basically have been ignoring the fact they've expired until we could get this to the council. Took this long because we had to get the parking committee together first. You're right, at the meeting they had last week, didn't have a quorum, fell one short, so they couldn't take a vote on whether they would recommend the renewal or an extension of these permits or not. There were some on the committee, I think, that were for it, providing an extension. Some were against. I have no idea how the final vote would have gone. The committee did last spring refuse to take a vote or declined to recommend 3-hour parking instead of 2. So I think that they did take a vote on. But if you don't take some action tonight, there will not be any more parking permits for the Argood Center because they have expired.
Counselor.
How long is the parking permit? What's the term for it?
They've been, when they were first approved, it was 90 days. That was last spring, and they received an extension, or last June. They received an extension in August for another 90 days. So that's what the history has been.
So are we then looking at another 90 days?
I think that's the question before you.
Sorry.
No. I was. My personal perspective, for what it's worth, is that another 90 days isn't really going to hurt anybody when the reality is the underlying issue here is that we were told that Colby students that lived in this building weren't going to park in that parking lot, and they are. And they're there all day. I come down here all day, and those cars are there. And so I feel like it's, yes, technically, are we giving some special treatment to the Argoods? We are, and perhaps potentially to the Villager as well, because that's part of it. A lot of those are dual customers there. At the same time, we did that with the commitment that we were going to try to come up with a solution to the problem, and we haven't come up with a solution to the problem. We haven't held up our end of the bargain on this, which is, I mean, I feel like another 90 days isn't going to kill anybody. I don't think we've had any major complaints from anybody about these couple of permits. I mean, we're talking about a handful of cars here. Yes, Councilor Coelho.
This is one of those things that sort of has driven me crazy being on the council, where we've talked about this parking ordinance, we've talked about zoning ordinances, and we do a lot of talking. And when we finally come up with a plan to do something, say like the ambulance backup service, then we rushed it. But on the flip side is this: can't we just make all of those spaces 3 hours? It just seems simple that at this point, the contention has been moving it from 2 hours to 2.5 hours so people can move around. Just make those 2-hour spaces 3-hour parking, and you've resolved all of it just in the concourse. Leave Main Street the way it is. I mean, for 6 months, we can't get a parking committee together to figure this out. That's ridiculous.
I mean, I agree that it's ridiculous they haven't solved this problem, but alternatively, there is all-day parking in the concourse. Mike, how many permits did we issue to Yard Goods? Do you know? How many permits was it? Was it like a dozen?
No,
was it
5.
No. How many total permits for their knitting class?
Yes.
30-something.
30. What I would say is that what I would be in favor of is issuing, I would even issue them permanent permits for people who have handicap plates. If you're somebody who is able to walk, there is all-day parking about 100 feet away from Yard Goods. So what we're really trying to address is people who legitimately can't walk the extra distance and need a place to park.
Correct.
And so I would rather we come up with a way to solve that rather than just giving 30 permits to anybody who wants to park there all.
That's basically what it is now. That's basically what it is now.
Right. I would rather focus on the people who actually physically are not able to walk from the all-day parking to Yard Goods.
Councilor Mayhew.
And from my understanding, Mike, all of what Ken Vlodek has said is that all of those 30 are are pretty much can't walk long distances, but I don't know.
Well, you'll find out if they
for
get
sure.
the plate.
No, they haven't.
We don't know for sure.
So this just skepticism on the part of what they're saying.
Right, because we haven't had any hand in giving them out.
Cindy, I am going to get to you. I have to let the council have all of their questions and comments before I go to the public.
You know, in reality, I think the fix is either going towards finding out who is really the handicap part of those 30, or we could look at the 3-hour parking signage to remedy that. But I think we have to do more investigation on that. As far as this permit's concerned, it could go either way, and up and down. We know, obviously, we can't keep on appealing to one business.
You said that the parking committee took a vote on 3-hour parking. Do you remember what that vote was?
The question came up at their meeting, the prior meeting. I don't know if it was June or whenever it was. Do you want to change from 2-hour to 3-hour? And no one made a motion to do that. So as far as I was concerned, that was a decision by them not to go forward with a recommendation.
Right, I would just say, I mean, for every business that would benefit from 3-hour parking, there are the business who would say that their business depends on the turnover caused by having 2-hour
I know
parking.
mine does on Main Street.
Cindy, why don't you come on up?
Cindy Jacobs, and I'm also on the library board. And this problem really can be solved fairly easily. I think when we built this building, we all understood that we would have what was called shared parking. And that basically means that businesses and customers park in the community, that's all over the community, during the day, and residents park in the community at night. Now, we all know that we're probably talking about our Colby students. I know they're working pretty hard to try to take care of that. The first year was very difficult. You guys that have all been on the council know that I had a terrible year last year with them. So we decided to not have the students be parking in the 2-hour parking. We may be moving to the next level where, you know, we ask the students to not park in the all-day parking. If we get to that level, which seems actually quite reasonable, you can add all-day parking over by the Yard Goods Center, and those folks can park there. I guarantee you that if you have them for handicapped people, those are not the people that are using them. And by the way, if you're going to be giving out handicap passes for people, I need about 60 at the library. And I'm just saying that because that's the God's honest truth. I do think we need to be working with Colby. They've been doing a very good job. You know, I think you all know, and I've told you before, that when we ask them to not park in the 2-hour parking, that these 9 spaces over here, for the most part, are kept empty. So I think we should appeal to them to ask them if they would consider monitoring more and not having the students parking, you know, park after 6 p.m., park all night. But it's basically, that's the concept that we all agreed on would be for the community to have residents. It's up here, it's everywhere. It's not just this building. But to make a community work, it has to be businesses and customers, you know, business owners, customers, and employees parking during the day, and residents park here at night. And that's all I have to say. I know it doesn't say much about the parking permits, but I would say we don't renew them, and that we need to absolutely come up with a plan that really, you know, states what we're going to do. And I'm not sure if we can, before we change the concourse, if we got a commitment to not have students parking in overnight, whether we could add those to the section over by the Yard Goods Center. I mean, maybe we could do that before a redesign. It seems like we could just mark the spaces. But anyway, that's my take on it.
Thank you. I appreciate the perspective.
Rian Finch, Ward 6. When this came up 6 months ago, I came up here and said, if you guys don't like the job the parking committee is doing, why don't you guys, because of the way that the parking committee was formed and it didn't have an end date, it didn't really have anything, has the council considered amending the role of the parking committee or amending the parking committee to essentially force them into action. 6 months ago, the issue was the parking committee hasn't met in a year. The parking committee hasn't done anything. Here we are right now, and we hear the parking committee met for the first time in I don't know how long, and they couldn't do anything because they didn't have a quorum.
They have, I will say, the parking committee, the links them on the email, they have had meetings, but I think it's been primarily concerned with the concourse redesign.
Okay.
But point taken.
But I
Point
mean,
taken.
yes, my general point is the council has the authority, based on the way that the parking committee was set up, to essentially force them into action. Why does the council not force the parking committee into action on this?
Can we start a whole new committee?
Kathy Weeks, Ward 1, Chair regarding the Yard Goods Center. We are not showing preferential treatment because if any other store wants to hold 2 or 3 hour classes, then I'm sure they could come and lobby the council for those parking permits. There are about 30 students because there are classes during the entire week, and most of them may not be handicap eligible, but they are older people, and walking across the parking lot is not feasible. The owners of Yard Good have come. They have talked about this in the spring. Of course, during the summer, we did not have that problem, so we all know what the real problem is. 2 weeks ago, when we had our first storm, I came down on Tuesday at noon, and in like the 2 hour parking, there were many cars covered in snow with out-of-state plates, so they were there throughout the night, and that continues. So please issue the parking permits for the Yard Goods Center classes.
Counselor.
Well, first of all, there's no specific language in this resolution, so it says regarding to see what decision the city council wishes to make. So I assume we're going to have to offer an amendment either way because there's nothing that says what we're deciding on. So I would like to offer the amendment that we renew the permits for yard goods for another 90 days, limited to the people who can demonstrate that they have handicap plates.
Is there a second on the amendment?
Second.
Any discussion on the amendment before we vote on the amendment? Counselor.
Speaking as somebody who does not have handicap plates, but is not as nimble as some of the other people sitting at this table, that's not necessarily the criteria, particularly at this time of year. Coming across a snow-filled parking lot can be very serious. I think your amendment is well-meaning, but fails to take account extraneous factors.
I guess I would just cut, like, there has to be a way to draw, there's a reason that there are certain requirements to get handicap plates, because they don't want to just hand them out to everybody. And so there has to be some sort of criteria for, like, for what we're doing, who we're giving these to. And at this point, I'm just not, because we keep kicking this can down the road, I'm not comfortable with just saying we're going to do this for everybody again. You know, I think there has to be some limit to it. And then I would also, I guess I'll wait till we vote on that amendment.
Is everybody ready for a vote on the amendment? All in favor of the amendment? All opposed? The amendment passes. Is there a motion to move as amended?
Frank, Coelho, and Morris were opposed? Yes. Is that correct?
4-3 today. Yes.
Thank you.
Move as amended.
Is there a second? Any discussion further on this resolution?
And it was for 90 days, right?
Yes. Yes.
All in favor? All opposed? Who is opposed again?
Coelho and Morris?
Okay, thank you.
Mayor was in.
He was in favor.
Okay.
Hopefully this one will be a little less controversial. Resolution 217, 2019.
Sorry, before we start, I have a 214 that talks about bingo.
Bingo.
I certainly don't want to deprive anybody from playing bingo.
That was under the
It was in the consent agenda.
consent agenda.
Oh, it was,
Yeah,
okay, perfect.
That was part of consent,
Thank
yeah.
you.
Okay, resolution providing for formation of a homelessness task force. Be it resolved by the Waterville City Council, acting as municipal officers as follows, that the City Council hereby authorize the formation of a homelessness task force, which will consist of no more than 8 members who shall be appointed by the mayor and serve until December 31st, 2020, unless the council takes further action.
Move to adopt.
And second.
So I'll explain this. This came into being. Maureen Osbrook, as you know, RevMo, if you want to raise your hand, is here. We had a meeting this last week, and we had a really great long conversation about the fact that homelessness is an issue. And one of the other conversations we had was about the fact that Waterville can't necessarily be the solution to the entire region's homelessness issue. But right now, we don't really even have a good understanding of what the problem is. And if we're going to talk about long-term solutions, and because one of the things we know just anecdotally from speaking to the homeless shelter, from speaking to our superintendents and school principals, is that there are homeless families, there are homeless school students, and these are all things that we need more information on. We want to have hard data, and then bring a lot of the stakeholders that might be able to address this issue in a comprehensive manner to the table. And that is why I wanted to form this task force. I will be on it. Mo will be on it. We have thoughts of who we'd like also to be on it that we'd invite. That's why I kind of left it open, that we could appoint and bring on folks throughout the way. But I think it's an important issue that we discuss and talk about here for the folks in our community. And I guess that's it. Do you want to add anything to that? But I would ask you to approve it anyway, so we could do that.
Well, I want to add my gratitude to you,
Sure.
Mayor. We have a problem. We're not sure really what it is, except that where it's coming from, what's causing it, how we're responding to it. I work with the homeless. I'm on the Interfaith Council. I'm at the Waterville United Church of Christ. And, you know, I'm being swamped. I'm getting phone calls from general assistants asking me to put people up in hotels. Okay, my ministry. All the pastors around town have pastors' discretionary funds. They're tapped out. I'm talking all the churches. I'm talking the rabbi, everybody. So we're feeling this need is increasing. You know, it's significant. And I'll give you one example. I spent hours one day over at the Mid-Main homeless shelter. Their staff was helping me. And we called every shelter for 100 miles. From Bangor, I can go all the way down, Skowhegan to Lewiston, Solon to Ellsworth, totally full. Because the shelter models today they used to be turnstile operations. Now people go into them and they stay there for like long-term transient housing. They can't be moved out. And so there's that problem, so there's this log jam. And I want to address, the mayor asked me a great question. You know, he obviously doesn't want Waterville being the oasis, the mecca of homelessness. I don't either. So where are these people coming from? Well, I can't answer that question, but I mentioned to you, Nick, I said that it's this highway, you know. It starts in some part of the state. People show up to a shelter, they're full, they say, go to Waterville. You know, we send them on too, you know, so people are in this huge migratory highway. And where are they coming from? Well, they have no homes, so they're coming from everywhere, you know. And so that's something that we want to nail down. And I don't have any answers. I'm a data cruncher. That's what I would like to do. So when I started discussing this with the mayor, he was right on it. You know, he's motivated by some really legitimate concerns, but I also think a great compassion. And so right away he came up with this idea. I've already mentioned it to some people. Deborah Spencer White, Katie, Spencer White at the Mid-Main Homeless Shelter wants to be on this.
Great.
And I just mentioned, I followed Sean Ebler out, And one of the problems we're having is like the homeless shelter doesn't keep data on how many people they don't serve. So they could say to you, we've placed 133 people last year into housing. I said, can you tell me you didn't place 700? She said, well, maybe. You know, but what really excited me tonight, I wanted to share this with you, Mayor, is Sean was right on it. And one of the firemen standing there with him said, we can get you some of the data. Never occurred to me. He said, when they call in, we ask if they're homeless. He said, well, I can give you a picture. So that's how this is widening, that we're going to have all these different stakeholders, people who know something about it, and then we're just going to collect data and bring it back to you. So I really appreciate you approving this, and you again, Mr. Mayor. I want to really thank you again.
Thank you for bringing. No, it's a serious issue, and if we ignoring it doesn't make it go away. So we might as well understand it and comprehend what's going on. Any questions? All right, all in favor? Thank you. And next is Resolution 218, 2019.
A resolution providing for appointment of Charter Commission members. Be it resolved by the City Council of the City of Waterville, acting as municipal officers as follows, that 3 additional members be appointed from the attached list to serve on the newly created Charter Commission, bringing the total Charter Commission membership to 10 people as follows, blank, blank, and blank.
Move to adopt.
Second.
And so we'll just amend once we figure out who the 3.
Yep, fill in the blanks.
Okay. Does everybody have the list?
I don't. I have letters, I don't know lists.
Hang on, we might have one here. I think it would be easier if we do. It would certainly be easier for everybody.
I have actually the ballots that you'll use. Would you like me to just read the list? Would that be helpful, or do you want me to pass out?
No, just pass out the ballots.
them out the
Yeah, I think we were all interpreting this as the ballot.
Yeah, I did too.
And a writing utensil.
Only need writing utensils, okay. I have a few.
I know how you feel.
Can we just summarize the process that we settled on at the last meeting for people who weren't?
I'd be happy to read the proposed process. Individual presentations will not be made by the applicants due to the number of the applicants. We actually had 17 people come forward. City councilors may ask questions of candidates. Most may be present, although some may not be because of the weather, I'm not sure. Each councilor will be allowed 3 votes from the list of applicants. Councilors will vote by written ballot by filling in the ovals next to their 3 choices and will identify their ballot by writing in their name and ward. The city clerk will read the individual ballots and tally the results. The winners will be selected by plurality. The 3 highest vote getters will be appointed. Ties may require an instant runoff election, and that's what we decided on.
So go ahead and vote, and Patty will pass it to Patty.
Unless somebody wants to ask a question of it. What? Unless anyone has questions for one of the.
Yeah, I don't have any.
Are all of the candidates here tonight?
I don't think, no, I've already seen some leave. And I know that some aren't here.
That speaks to their commitment.
Same as here.
Do you want to just pass them down, or would you like me to collect them?
Oh, I didn't think so.
And did everyone put their names on their individual ballot?
Yeah. Could Jay vote? Yep. This is the longest meeting of like.
Just give me moral support.
You can vote, yeah.
Okay.
You have to, no, the results by counselor have to be read out loud under freedom of information.
Right. So Ward 1 is a vote for Sandra Burdick,
James of Liberty,
James LaLiberty,
Tom Nail.
and Tom Nail. Ward 2 is a vote for Sam Burdick,
Same.
James LaLiberty, and Tom Nail. Ward 3 is Sandra Burdick, Tom Nail, and James LaLiberty. Ward 4 is Jay Coelho, Nick Isgro,
Tom Nail.
and Tom Nail. Ward 5 is Jay Coelho, Nick Isgro, and Steve Soul down here, okay? Ward 6 is Sandra Burdick, James LaLiberty, and Steve Soul. Ward 7 is Sam Burdick, Jay Coelho, and Nick Isgro. 5. Okay, so the highest vote getter is Samantha Burdick with 5 votes. The second, there's a tie for the second highest. There's 4 votes for James LaLiberty and Tom Nail. So the 3 chosen would be Samantha Burdick, James LaLiberty, and Tom Nail. Can I have a motion to amend to add those 3 names?
So moved.
Second.
All in favor?
Okay. Heck yeah.
For the folks who may wonder, I'll be in contact with all the Charter Commission members, the newly appointed members, to determine availability within the next few weeks to conduct the required organizational meetings. So I'll be in touch, maybe not tomorrow, but certainly Thursday of this week.
I hate to be a stickler, but we only voted on the amendment. We didn't actually move the resolution as amended.
Oh, thank you.
So I'll move it as amended.
And second.
All in favor?
You're correct, thank you.
Is there any counselor updates?
Yep, just one.
Okay.
Just wanted to bring up a topic that was at the parking committee, thought this was appropriate time to talk about it instead of the yard goods center. But we did discuss enforcement of parking in general. Obviously, the main focal point being the concourse. We still believe that there is an issue with some Comey students not, that are offenders, especially in this type of season with the winter and the snow. But also, just in general, we're talking about parking lots in malls and stuff. We proposed with Chief Massey having a 6-day parking attendant instead of a 5-day, which to the revenue from the tickets that are coming in from the enforcement of parking has been very generous, to the effect that a 4-hour shift on Saturday has been proposed. So the signage would have to be changed. We are in full recollection of that. There are some
Council will have to vote on all of this.
measures as far as decals, but that has been proposed for moving parking enforcement to Monday through Saturday instead of Monday through Friday. So I wanted to give you a heads up on that, and that's what was discussed, and that's what's probably will be coming before you shortly.
Any other counselor updates? Community notes. Is there anybody for community notes?
Mayor, if I may.
Yeah.
We're in the process of gathering interested citizens to serve on various boards and committees. So if anyone is interested in serving on a committee, we would ask that you get an application in to the city clerk's office as soon as possible. And those applications are available online or in the clerk's office.
All right, Mike, manager's report. We've got it, dude.
Item 1, streetlights. So that work starts next Monday. It starts in the, I believe, Ward 1 area, right, Mike? Morris? Looks like the, yeah, Eustis Park, Upper Main, Ridge Road, Pleasant Hill. So 3 sections of the city, they've divided up in terms of these new street lights. Take about 6 to 7 weeks to get all the new lights. We've been saving money since the middle of summer when we actually purchased the lights, the old lights from CMP, so we were able to stop paying that light rental fee, call it that. And we'll save a lot more once the new lights get in and use a lot less electricity. Item 2 is certainly good news. We were able to find someone to take Nick Champagne's place. Nick leaves us December 20. Andy McPherson will start next Monday. You'll get to meet him at your next council meeting. He lives in Hollowell. He's been an engineer for many, many years, worked on many different projects. He served on Hollowell City Council. He actually was mayor in Hollowell for a year or 2. So he's familiar with local government. And I'm very happy we were able to find someone with that kind of experience. But we advertised for 2 months and got no one. And actually went back to when we hired Nick, and this fellow had applied and was still very much interested. He hadn't seen our ad. So he's coming on board next week. I think maybe all of you know about item 3. You know, the Lockwood Mills, that's hugely important that they receive the housing subsidy from the Maine State Housing Authority, so the work on those mills next to the Hathaway building is going to start, I hope, early next year. So that's a huge project. It'll take time, but that's a very important start. The last thing is just to let you know that we got a huge refund from our workers' comp carrier, pretty much as a result of the safety committee. Bobby Joe is our human resource director, manages our safety committee, has a number of department heads in on the committee. So every time there's an accident or something happens with our work crews, that is reported to our safety committee. Pretty comprehensive study is done or analysis done. Why did it happen? What could have been done to prevent it? And our carriers watched this happen over quite a bit of time. The safety committee would work. And so that $18,000 credit was applied to our workers' comp bill. Our workers' comp bill is about $235,000 a year. So it's a fair amount. It's a fair amount. And our mod rating, our experience rating, which has been high, at 1.19, which means we're 19% above the average. The average would be a 1.0. 1.19 is what it's been, and it's going to go to 1.08. So that modification rating is going down, which means that $235,000 a year we pay should be going down. That's good news. Yes, sir?
Present a decrease in the number of accidents that have been reported to workers' comp?
Yep. It's definitely related to payouts that had to be made as a result of workers' comp injuries and things like that.
And you attribute that to the safety committee?
Some of it for sure. Yeah. Yep. And I think also probably, hopefully going to be good news with our health insurance, because our experience in health insurance claims this past year has been quite a bit below what we've been paying in premiums. For a couple of years, we were costing more than we were paying in. So that hasn't happened in 2019. That's it for me.
Can I get a motion to adjourn?
So moved.